The patient Jane was referred by her psychologist, Dr. Jones, to perform the Wechsler Intelligence Scale for Children, or WISC, due to her declining academic performance. Her scores were calculated as 104 for Verbal Comprehension Index, 102 for Perceptual Reasoning Index, 86 for Working Memory Index, 91 for Processing Speed Index, and 97 for Full Scale IQ. The score of 104, 102, 97, and 91 are considered average. However, the score of 86 is considered low average. We have learned that Jane has an average level of cognitive and intellectual functioning. According to the report interpretation, her scores reflect that her thinking and reasoning skills surpass 42% of other children's scores at her age. The test was also revealed that she reasons well, both with and without words, and falls within the average range for children her age. Jane tested in the low average range for working memory, being above only 18% of her peers, which may demonstrate weak mental control as evidenced by difficulty in remembering long strings of numbers. This indicates Jane may have a longer processing time when digesting complex information as compared to other children her age. This may also explain the academic difficulties that have been noticed by her teacher, according to the referral reason. Jane scored higher on the arithmetic subtest than the letter number sequencing subtest, which indicated a specific ability for numerical operations and math reasoning. Jane also only scored above 27% of her peers and tested poorly on processing visual material, which is indicative of the vision difficulties that she may be experiencing as evidenced by her mother's observations. This may add to the difficulty in working memory and poorer academic performance, as it will be much harder for Jane to process new information as compared to 73% of her classmates. This may also affect her ability to process new information because she will be more mentally tired, preventing the task of understanding the new information. Jane's weaknesses lie in the visual processing test with a score of 9 on the block design subtest. According to the report, this indicates that her greatest struggle is organizing visual information and spatial reasoning. Her strength was indicated by the matrix reasoning subtest with a score of 12, which indicates strength in abstract reasoning skills, also making sense as to why she performed well in arithmetic and with her mathematic reasoning skills. Recommendations for Jane include extra support from teachers and families in helping Jane repeat information frequently to assist in memory retention. Using the method of chunking by grouping large chunks of information into smaller chunks to be memorized may be employed in order to solidify the patient's working memory. Lastly, encouragement and support should be provided to Jane on quality of work and completion. Not so much high grades should be encouraged, as that may cause anxiety for Jane and would make her feel potentially inadequate if she is unable to perform at those high levels.